What sort of T cells are involved in the different and what about the cytotoxic T cells? Those are responsible for the killing the virus infected cells or any tumor cells.
They help the T cells and use the cytotoxic to kill the tumor cells.
At this point, do you want to write down any more LOs?
Yeah, one would be the pathogenesis of the disease.
Alright, also, like the scenario says that the person is HIV positive, but does anyone know how do you find out that a person is HIV positive? What are the tests?
Because the first thing we're going to do the PCR test. That's going to tell us the virus is present. And then we can follow up on the blood test, the blood count, the white blood cell count.
We also do ELISA.
We can
Yeah, would the white blood cell count go down immediately, like in the initial stages of the disease?
Ma'am, it really depends on what time does he come to the physician, when he's suspected. I mean, generally when the AIDS progress, the symptoms are usually of like flu and stuff. So patient generally takes it he's got like a viral infection. Patient is generally going to come to the doctor when he's going to have the AIDS and symptoms like, he's going to have lung symptoms and stuff like that. So at that case, the CD count will already be pretty low.
Alright, then in your LOs, write down symptoms with respect to HIV stages.
signs and symptoms of each stage.
Yeah.
And I think first we should
covered in the progression of HIV.
No, but see, that also involves the lab investigations and everything. So signs and symptoms
I think there are blood examinations and then there are those molecular marker techniques that we have, the PCR, the ELISA, the DNA analysis also can be done for the
right,
HIV virus.
okay, lab findings. Lab findings / investigations for HIV.
Then let's talk about the complications of HIV. What do you think, what further signs and symptoms would develop in this HIV positive patient?
Hansa, I want you to contribute.
Okay. Because of the opportunistic infection. Okay.
All the opportunistic infection like bacterial virus.
With regards to the signs and symptoms, what complications? Like how do we approach the patient and tell him that because you have this disease now, you could further have these signs and symptoms. So don't worry because it is part of the disease. You could have these. Like as regards to the signs and the symptoms.
Good thing he's going to have candidal infections, so he's going to have a lot of oral infections. He's going to have fungal infections like acne, foot, and stuff like that.
Means lesions on the skin.
It's a mirror sort of disease. He could lose his eyesight, he could have difficulty swallowing, he could have different type of cancers anywhere, small cancers. Cancers would metastasize easily in their basic stages. Basically, he would have all
the patient is immunocompromised. He can have any infection.
It's not necessarily that opportunistic infection.
That's true.
We can have an opportunistic infection.
In the future. Any kind of opportunistic infection would be there and complications.
Any infection from
Yes,
outside.
sorry.
He's even going to have infections from the natural flora, which are present in the intestine, stuff like diarrhea and super infections and stuff.
Only if we get to know what he is suffering from can we first get to know about the complications, the most common ones which we will have.
Most sites are like near the bowel or which are more prone to the infection. Like near the bowel there can be actually more.
Because of the presence of the
Presence of
normal
normal
flora.
Alright, so Qasim suggested that we make an LO of the opportunistic infections that can affect HIV patients.
I think we should tell the patient how HIV is spread so that he has an awareness, or other people should have an awareness that it's not spread through hands or by touching.
That would come to his
Alright, good point, Sana. You guys can expand on that.
Because like after signs and symptoms, complications, we talk about the treatment and then the social issues. So okay, what about the treatment? Anyone knows anything about the treatment? Okay, Kashif.
I think that the patient has got HIV, but the most important thing that is 1 year old baby. Care should be wanted so that the doctor should also tell him that she should not also be taken, but because he has got HIV. But the question is about his 1 year old baby and his wife also.
As HIV patient, there may be
personalized treatment for the HIV, it's basically HAART, HAART, highly active antiretroviral therapy. It includes 4 things. Number 1 is the nucleoside or the nucleotide reverse transcriptase inhibitors. Number 2 is the non-nucleotide reverse transcriptase inhibitors. Number 3 is the protease inhibitors, and number 4 is the transfusion inhibitors. And basically, fusion inhibitors. Okay.
I don't think there is any cure for AIDS or HIV. The only thing we can do is to prevent the disease from
Yeah, we give this treatment just to control the disease and
Expand the healthy lifespan of the patient.
So the treatment is just stop it.
Alright, when Reed was telling us some
very
technical things, let her
This is important for controlling the progression of the disease.
Yeah, okay. There basically the 2 regimes. Either we can give the 2 NNRTIs, that is the nucleoside or the nucleotide reverse transcriptase inhibitors, and 1 protease inhibitor. Or the second alternative is we give 1 NNRTIs, nucleotide reverse transcriptase inhibitors, plus 2 non-nucleotide reverse transcriptase inhibitors. Okay, and does anybody want to know about the drugs?
I think yes, we should discuss about the drugs. The names of the drugs. Yeah, because we have to inform the patient. Yeah, because then we try it in yellow to find out more about it.
I can learn those.
Okay.
Lamivudine, and fluoride is very important.
And that becomes in the
These
non-nucleotide.
are non-nucleotide.
The zydovudine become in the
Lamivudine and fluoride. And fluoride is a fusion.
Okay.
So, yeah, we cannot treat HIV, we all know, this is because of the structure of the HIV virus, which does not allow all the drugs to completely eradicate the virus. So, anybody know about the structure? Bilal?
Because it is called reverse transcriptase, it has a potential ability to change its genome from DNA to RNA. So when we specify a drug for the treatment, there is a lot of mutation in the genome. The virus can change its genome from DNA to RNA by the use of enzyme reverse transcriptase. That is why the treatment against this virus is very difficult, because of the ongoing mutations which inhibit the proper prevention.
Okay, I think
And
what yellow should be.
secondly, there is another form of mutation in these kind of viruses that is known as drift mutation. Drift mutation is sudden change of nucleotide sequence from one to another. This is known as drift mutation. Therefore, there is no treatment.
drift sudden and shift sudden.
Shift is sudden, drift is gradual.
Okay, remember this mnemonic. Sudden shift is more dangerous than gradual drift. Okay, you know which one is sudden shift.
Komal, one yellow should be why treating HIV is difficult.
Treatment.
One is treatment and one is why as regards to the structure. Yes.
I would like to add that he would need a lot of psychological and support and some sessions with some therapists as well, because there's a lot of stigma about people with AIDS. And another thing is people with AIDS tend to be very much depressed. So he will probably lose all hope in life and he wouldn't want to work anything. What he has to be counseled that it's not the end of life. Whatever you have a short life, but whatever you have, you will have a quality piece of life. So he needs to be counseled.
So always